transition, so no panic. So I just would like to welcome everybody to our webinar this afternoon, Mental Health Help for Caregivers. I will be introducing Sarah Hamid Balma and Hardeep Thind. They will be doing the presentation this afternoon. I'm just going to quickly give you an overview of Family Caregivers of BC and what we are funded to do here in the province of BC. So Family Caregivers of BC is a nonprofit charity dedicated 100% to the well-being of family caregivers. And we've been around for 29 years. It will be 30 years in July. And we have been serving the whole province for the last 5 years with Ministry of Health funding as part of the Patients as Partners initiative. We're absolutely thrilled to be able to hold webinars like this and run some of our other programming with this funding. We are one of only 3 provincial organizations in all of Canada, the other 2 being Alberta and Nova Scotia. And we get a lot of people from across the country attending our webinars. So we welcome all of you, and particularly the folks in BC, because that will be the focus of our content. Just before we leave, Family Caregivers of BC and what we do, we have 3 main pillars in our. All right, so thrilled, as I've been talking about already, that we have 2 presenters today to talk about this challenging area, mental health help for caregivers. Sarah Hamid Balma is the Director of Mental Health Promotion for the Canadian Mental Health Association in BC. And Sarah has a master's degree in health communication and has been working in the mental health area for about 20 years. If you haven't already seen the Visions magazine, it is amazing. It is such a good resource. You can get that magazine by going on the Here to Help website or going to the Canadian Mental Health Association website, and they'll be providing information about that. But it's just a really, really wonderful magazine. Lots of stories about caregivers and the types of situations encountered in terms of mental illness. She also is the webmaster for Here to Help, and she's going to be talking about that website some more today. We always refer caregivers to that website. It is an excellent, excellent resource. Hardeep Thind is an educator for the Schizophrenia Society, and Hardeep as well has extensive experience in the mental health field and also has a family member. So she's lived both sides of this as an educator and a caregiver. So totally understands how important it is for families to be included and supported. The BC Schizophrenia Society, if you're not already familiar, is a province-wide support system for families and people affected with mental illness, dedicated to supporting each other, educating the public, raising funds for research, and advocating for better services for people with schizophrenia and other serious and persistent mental illnesses. So I'm absolutely thrilled that Sarah and Hardeep have agreed to do this webinar for us today. I'm just going to check to see the interest areas. So again, we've got mental health service providers. People are really interested in tips to deal with a distressed loved one, and yeah, all of the above. So I'm going to now change our. Sarah is up in the left-hand corner of your screen, and Hardeep. Welcome to both of you. And I'm going to turn it.
Thank you, Janet. On the left in that red shirt, and Hardeep and I are going to split up the presentation, but we're both delighted to be here and hopefully answer a few questions, or at least help you feel a bit less alone in the questions you do have, or both, as we work through a few key resources and strategies that you might want to use in supporting a care recipient around mental health problems. So hopefully you're seeing the slides advance. Janet's already done a wonderful job of introducing us, and so that's us again, so I won't belabor that point. But I just wanted to sort of indicate the relationship of the organizations that we're attached to and mention how we're connected to Here to Help. So, oh good, I'm glad that people can hear me okay. I am not using speakerphone. I am I have a nice curly cord and everything, so that's probably why you can hear me okay. So I work at the Canadian Mental Health Association, BC Division, and we are a nonprofit, a charity, just like the BC Schizophrenia Society, and we support improving mental health for everybody. So we have a very big mandate, and that includes preventing problems. So we work around sort of stress and resilience, but we also work around supporting recovery around mental illness or substance use problems. That's in our mandate as well. And I work at the provincial office here in Vancouver. We have a satellite office in Victoria, and then we're connected to 14 independent CMHA community branches that deliver local programming, and there's another, 70 plus from Alberta east. So there are CMHAs across the country. And you've learned already about the BC Schizophrenia Society. Hardeep, if you're on, do you want to just let people know a little bit more about the educators and maybe about the myth that you're just about schizophrenia when you do so much more?
Wonderful. Thank you, Sarah. Yeah, I'm with the BC Schizophrenia Society, and we too are a national organization, part of the Schizophrenia Society of Canada. And we, like our names say, we support folks with families and members with schizophrenia, but we don't limit it to just families with schizophrenia. We welcome anybody that comes through our doors. In our support groups, people may come who've got a loved one who has bipolar disorder or depression, anxiety, that sort of thing, because we find there's not too many places. Okay, someone can't hear me well. Is this better?
Yeah, that's.
And so, yeah, that's what we do. There's 24 folks like me throughout the province providing similar types of services. And I used to be in the Surrey, Delta, Langley, White Rock region. I've just recently, in the last 2 months, moved over to the Vancouver, Richmond region. So I'm new to the region, but not new to the organization. And I'm really looking forward to our discussion.
Thanks, Hardeep. I always hate introducing someone else, and I thought it would be much better for you to talk about BCSS. I'll try not to use acronyms, but that if you see that occasionally or anywhere, that's what we're referencing. So CMHA, Canadian Mental Health, and BC Schizophrenia Society, we are two members of sort of a collaborative called Here to Help. We're also known as the BC Partners for Mental Health and Substance Use Information. And so we have a magazine, we have a website, we have a number of different projects. We're all still 7 different nonprofits, but we do a lot of our education and health literacy work together. So we're just 2 of the 7 members that do the most work, probably supporting families of adults, and that's why the 2 of us have decided to join today. And I'll let you know a little bit more about the Here to Help initiative in our resources section. Okay, so just a quick overview. I'm wondering why I didn't realize I had, okay. Sometimes I forget when I animate and when I don't. So just a reminder of the sections we're going to be covering. It sounds like people are interested in most or all of these sections. And we'll probably, Hardeep and I will pause after each section just to make sure you have time to ask questions. I find it really hard to kind of wait for an hour and whatever, and then weigh in with all your questions at once. So we'll give you lots of opportunity to ask. And of course, please feel free to use the chat box at any time. But we'll be looking at sort of some of the major routes to mental health care for adults in BC. We're not going to talk about youth, obviously. And some of the routes are going to be similar across provinces, so we hope that people outside of BC get a little bit of value out of that section as well, even if some of the routes will be very unique to BC. And then, so I'll be covering that section, and then Hardeep will talk about some of the tips that we would suggest, or that have that are grounded in good practice around supporting someone who's living with a mental illness or a mental health or more than one, as well as how to support yourself, because it can be very, very stressful on your own well-being. And some of the strategies we'll be looking at for dealing with a loved one. Just a reminder to mute your phone if you're on phone. As well as looking at preventing and planning ahead around relapse, because mental illness is unique in that way. Some chronic conditions as well can be episodic, but that relapsing remitting feature can be challenging. So how to plan ahead for that. And then I will cover sort of the last section around key resources, different courses or workshops, other support groups, that you may want to consider, and some other sort of print or web or agency-type resources and phone numbers and things that you might be aware of, and some of them might be new to you. Hopefully that makes sense. I'll just keep plugging along here. So this is just a reminder. I did this sort of word art, or they're called wordles, just showing just some of the mental disorders and mental illnesses that sort of exist. Don't worry about the size of them. That's just that's randomly done. But to give you a sense of just the broad umbrella that we're talking about when we're talking about illness, and it's not one thing. It doesn't look all the same. So you can see it's really diverse. But what they all have in common, that they all affect your thinking, emotions, perceptions, relationships, and behavior. So really, really core human stuff, and that's why I think it can be really, really hard. I should also mention that I support I'm not a caregiver myself, but I lived at home while my mom was taking care of my grandmother with dementia and depression, and then recently now with my dad, who has a different type of dementia. And I see how challenging it is, and how often she tells me she wishes he had a different kind of disease. She wishes he had cancer. Not that she would wish it on anyone, but if she had to choose, how she wishes it was something that didn't get to those core human things around his emotions and his perceptions and cognitions, that was doubly hard for her, that it affected the things that made him him. And we also know that mental illnesses frequently coexist, as you probably already know, with chronic physical conditions, especially depression and anxiety, and of course with disabilities and brain injuries, substance use problems. Really, you can have mental health along with, so mental health challenges have a profound ability to change your functioning, and because they're episodic, so you tend to go through periods of wellness or relative wellness and then periods of ill health. That can make it really challenging for both the person experiencing them and anybody who's living with them, of course. You probably won't be able to read this very well. Sorry, I couldn't find a higher resolution version, but I just love this cartoon. I'll just read it to you if you can't read it. So it's, I guess, a caregiver speaking to their partner or their loved one, and it says, "Listen to this. In order to be eligible for public home care services, people must first have exhausted the caregiving and support capacities of friends, relatives, and other community members." And then their partner's like, "Exhausted is right." And yes, I think everybody can empathize with that, and I can certainly see how my mother has been completely exhausted. And so the mental health system, I mean, you're already having trouble navigating probably symptoms and behaviors, and then trying to figure out services on top of that can be really, really challenging. Yet we all know that family and caregiver support makes a huge difference to a loved one's recovery, their ability to access and advocate for care, and basically our healthcare system would fall apart without the support of informal caregivers. So thank you for all that you do, and I hope I can give you a little bit of the lay of the land. So I won't belabor the point, because I think some of you might be like, I know what these groups are, and some of you might be like, I had no idea this person had a role in mental health care. So I will try not to go too slow or too fast, but please let me know if this is too much of a review. But basically in this slide, what I wanted to present was around some of the different people who you might have access to in BC, and actually outside of BC as well. And in some cases, you might actually have many of these people involved. But this is sort of how some of them play a role in sort of mental health care, especially when someone wants to, if your loved one, your care recipient, is realizing that they need some support and help. There's a whole other presentation we can do if your care recipient does not believe that there's anything wrong and they have no mental health problem whatsoever. There's a whole other sort of, I think Hardeep and I would have to come back and do something else around that. But some of the resources for you is sort of a family doctor or a general practitioner can look into other symptoms, causes of symptoms. So the reason that we still promote that people see the family doctor before they go off and see specialized services is it's really good to rule out other things going on, especially if they're, the person might be older, might have other chronic conditions. If they are appearing depressed, is it actually a thyroid problem? Like, there are a lot of other things that can mask mental health problems. So it's really good to just make sure you get a good checkup and make sure it's not something else that can explain those symptoms. Also, many specialized services, including access to a psychiatrist and some other programs, need a doctor referral. So having a family doctor, or whether you have to go through a walk-in clinic, or there are, you can see a doctor virtually in BC through a number of different platforms, and that's covered by your care card. And if anybody is interested, I can give you some of those platforms later. But you can see a GP through your phone or your tablet, and you can get referrals, and you can get prescriptions and all sorts of things that way if you don't have a walk-in clinic. And for people with depression and anxiety, actually a family doctor is pretty much the main support. Most people do not see a psychiatrist or need a psychiatrist for conditions like depression or anxiety. And psychiatrists are really, really hard to get to, so I'm going to, that's the next thing that's there. So psychiatrists are medical doctors, so they're doctors as well. MDs, they have specialized training in mental health, mental ill health. So they can diagnose mental illnesses just like a family doctor can, and they can prescribe medication. But usually, actually in all cases, a different doctor has to refer you to a psychiatrist, and their fees will be covered by your insurance, your care card, your medical services plan. But they can take a very long time to see, outside of an emergency situation. So they're generally used, I find, they're generally used for more complex cases if there are multiple issues going on, or it's something that's way beyond the skill of a GP to manage. And they're not a route for long-term counseling or psychotherapy. It's very, very rare for someone to get sort of a long-term talk therapy situation with a psychiatrist. So just to be aware of that, they're usually sort of very limited in their role. Social workers and nurses may also be involved, psych nurses especially, may be involved in mental health care. Often they are attached along with occupational therapists and peer support workers in mental health teams or mental health centers. So those are run by health authorities. We have the regional health authorities in British Columbia. So we have Northern Health, Island Health, Interior Health, Vancouver Coastal Health, and Fraser Health. There's also First Nations Health Authority and a provincial health authority. But most people are going to go to one of those 5 regional ones, and all of them, pretty much any urban center, there's probably about 100 in the province, will run what's called an adult mental health team or adult mental health services or adult mental health center. And that's where they will do case management, and they will, that's all covered through your medical services plan, and they can offer a range of support for people who need more support than a GP can provide. And again, they tend to work with some of the more complex conditions, though. Sort of just depression or just anxiety are usually not enough to get you to a mental health team. But bipolar disorder would, psychotic disorder would for sure, as well as sometimes some coexisting things. And peer supporters and peer support workers. So those are people who've experienced a mental illness or support a family member to do so, and they use their experience to provide support and navigation help. And they sometimes will lead support groups, and they often work within and alongside medical health services, and you can find them sometimes within these mental health teams at CMHA branches and through BC Schizophrenia Society. They might be called different things, but if you see that word, that's usually what that means. And then some other folks more in the private, usually in the private sector, you have sort of alternative or complementary providers. Some groups will find some usefulness there, might be an acupuncturist or a massage therapist, naturopath. And just be aware that some treatments probably shouldn't be used alongside other treatments. For example, if you're using certain medications and then you decide to use certain herbs, it's important to talk with all the care providers about all the approaches you're using, because even if it's a natural herb, it has effects, and it can interact actually with other medications. So it's important to talk to your pharmacist or or all of your care providers, make sure everybody knows what everybody's taking or trying. And keep in mind that usually complementary, unless you have workplace insurance, usually those are out-of-pocket expenses. They're not covered by medical services in most cases. And private counselors, I mean, our biggest question we get is, how do I get access to counseling? And, you know, if you don't get coverage through your campus or your workplace, it's not covered by medical services in BC. It's not covered by health insurance. And so, you know, they weren't at the table way back when the Canada Health Act was done. So counseling is not paid for, and you have to pay for it out of pocket. But the good news is that no referral is required either, so that means you don't have to wait a long time. And there are some places, actually in every community, in most communities I should say, that have access to lower cost counseling. They're often provided by nonprofit agencies. So if you have trouble finding lower cost counseling, you don't have access through a workplace or a faith community or some other system, then, you know, contact your local CMHA for advice on how to access lower cost counseling for maybe either your loved one or yourself. And some have sliding scales as well. So that was a long, I'm not going to take along on every slide, but that one had a lot of people on it. Before I pass it over to Hardeep, just wanted to mention, so those are some of the people that you might interact with in getting help for your care recipient, but there are also different places that you might, or settings where you can access care. And so as I just mentioned, you know, a way that many people access sort of free mental health care like counseling and other services is through networks they're already connected to. So workplaces may offer an employee and family assistance program, sometimes called EFAP, or extended health benefits, which can provide free short-term counseling. And if you aren't sure if you have access to that, definitely look at your booklets. Again, campus counseling services, if you're, you know, maybe you're a part-time student as well. I know caregivers like to do it all. Often will get free counseling, and some faith communities will run helplines, support groups, and other services. So if you are connected to a cultural or faith group, definitely ask, because you might be able to get access that way. And community mental health organizations like CMHA, BCSS, a few other provincial ones that I'll note at the very end, they can also help connect you to service providers. So there's, you know, when you get stuck in terms of, I don't know how to navigate all of this, contacting a local mental health group like one of ours hopefully does help. And then finally, health authorities. Those are those government-funded groups in the regions. They're called different things in other parts of the country, but we call them health authorities in BC. So they deliver many of these services, and they can provide a lot of information around, you know, what are usually outpatient services, so where you don't stay in hospital, but you might actually go into hospital to get a course or a workshop and then go home. They also fund the mental health teams. Sometimes there are geriatric teams that are part of those. And so because these are government programs, they're free, and so that's why it's important that you know about them, because caregiving can be very expensive otherwise. You might need a referral for certain services, or you might have to meet certain severity, might have to be a certain severity or seriousness to access certain kinds of services. But definitely, if you've never contacted or looked at your health authority website, you've never gone to Interior Health, you've never gone to Fraser Health or Island Health, Vancouver Coastal Health or Northern Health, those are definitely places that you should be looking at.
So Sarah, Sam just, sorry about that.
Okay, so I'm going to pass it on to Hardeep, but I think there's an echo there, so.
Bad echo. Is that a question or a comment?
Yes.
Yes, Sam had
a question.
Yeah, and I think actually, Hardeep, you could probably address that, because there are some supports in northern BC, and I think there's an online support group that the provincial, your provincial office still hosts.
Okay, wonderful. Thank you, Sarah. Yeah, I mean, for folks that are already on here probably realize that as caregivers, you guys really are the key to recovery for a lot of folks, right? And so, you know, sometimes we are part of the care team, and sometimes as family members, caregivers, we are not. But A lot of times families can identify when their loved one may be having a relapse. They're able to know kind of something's maybe going a little bit haywire. They're maybe off medication or not taking medication at the right time, doing a variety of different things. So you would be the first one to probably gauge some of that stuff. Even though they may have support team in place, they don't see them very often, right? You guys are usually with the folks, even if you don't live with them, at their other end of a phone call, and probably at the end of a phone call 15 to 20 times a day for some folks. So you can hear, you can sense, you can gauge when some things are not going well, and you can kind of hopefully get them into some treatment or get a phone call out to the support team and get some help for them. And that's kind of the big piece that we at BCSS do, is we really help to empower and help family members advocate for their loved ones. We have a lot of issues around confidentiality where service teams aren't always open to welcoming family members, but we're fairly creative of ways to get around some of that information and logistics. We've been fairly successful. I would like to say that we do get family members that want to be a part of it, to try to get to be a part of it. Unfortunately, with the illness comes delusional thinking and paranoid thoughts, and many times it's the family member who is, part of, in their mind, part of the conspiracy, so they try to push their loved ones away. So there will be many families trying to be supportive and engaging and trying to be right there alongside their loved one, but they don't always get the opportunity because of the person's potential delusional thoughts that are going on, claiming that they're the ones that are causing all the problems, or they're the ones that are making them sick, or they're the ones that are sabotaging relationships, or putting microchips in and reading their mind and doing all sorts of different things. So it's a really hard balancing act for families, I find, to really figure out how to get involved when maybe their loved one doesn't want them to, or the service team that they're working with doesn't always welcome them. But it's really kind of crucial. Sorry, did I hear a question, or is that my echoing back? There's different ways that one can get involved and try to help with their loved ones, but we offer support groups, an opportunity for folks to come together with other like-minded families in a really safe environment. Many come to listen, many come to participate. Really, you come, bring what you can, and be a part of what you can offer that day. We offer a lot of one-on-one to help family members support their loved one. We also do a ton of education. We offer an amazing course called Strengthening Families Together, a 10-week course that's just got incredible information in there, really good resources. You take home that binder at the end of your 10 weeks, and it's kind of your Bible, if you will, to kind of refer back to when you're ever up against a situation and you can't recall everything you've learned in the course. It's got some great tools at your fingertips for, communication stuff. A lot of that sort of stuff kind of we forget when we're kind of in the heat of the moment and things like that. We're on to slide number 9. Or 10 now. There's just 2 quotes that we have up there for you guys to take a look at. So you can have various different levels of folks that are engaging with family members, and some that are not totally open to receiving family support. Just moving on to the next piece now, dealing with distressed folks. When our loved one is agitated, irritated, maybe in the middle of paranoid thoughts, ideations, that sort of thing, it's really important that we try to maintain a sense of calm. It's very easy for us to get just as excited or excitable as they are sometimes, and it's really important that we try to maintain a sense of calm, keep stimulation and obviously different stress levels at the lowest possible level. What we find a lot of times when we're asking loved ones questions, their brain is in overdrive sometimes, and we're kind of badgering questions at them. Remember, what's going on? What can I do? How can I help? You just go, 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 and it's just too much for them to process. So maybe ask a question, take a few minutes to wait for a response, hear them out, see what they have to suggest, Sometimes it's really overwhelming, like sometimes to make a decision if they want a red candy or a blue candy is just too much, right? It's just like offer them two choices and kind of help them kind of make a decision on one or the other. I'm just minimizing it in terms of candy-wise, but sometimes we're just throwing so many things at them. We think, I'm just asking you a simple question. How come I can't get an answer? What do you want me to do? How can I help? What should I do? And it's really, really incredibly overwhelming for the folks because they've got a lot going on in their mind at this point in time. So they're trying to maintain sense in their head. They're trying to make sense in their environment, and then you've got somebody trying to yell at them or not, trying to get their attention, so they're kind of talking in a raised voice. Talking in a raised voice usually doesn't get any better attention. It just escalates the problem. So really try to maintain a sense of calm when you're doing that. Folks, when they're irritated, agitated in that state, usually don't like anybody touching them. So it's usually not a good time to maybe grab them by the shoulders, even if you mean it in a supportive, kind way. People can feel that fairly threatening. So we have to really think about when we're interacting with our loved ones, that we maybe aren't using all the same techniques that we're using with folks that are not experiencing maybe a delusional thought or having some thoughts around different paranoid things that are going on. And a big one is about avoiding arguing. When someone's really delusional, you can't argue with them and say, no, I'm right here. Look, there's nobody else around. It's just me. You can scream that to them until you're blue in the face. And if they really perceive a threat or feel that somebody else is around and in their space and they're feeling threatened, they really do. It doesn't matter what you say to them. So it's probably a better idea to do a little bit more of a distraction strategy where you just kind of accept that they're quite agitated and heightened by what's going on, and accepting that they're maybe in a paranoid state right now, but then just offering kind of a simple little, shall we sit down here? Should we move over here? Should we stand against the wall? Can I get you a glass of water? That's kind of more of a distraction technique as opposed to really worrying about what's happening in their current state of mind for them right now. So I'm sorry, when I'm talking, I can't screen on the side. So if there's a question for me that's coming up, I do see a whole bunch of stuff screaming along. I just, if someone can read out the question to me, I might be able to answer it.
Yeah, Hardy.
Hardy, we've got a couple of questions.
Okay, sorry. So,
Sam has noticed that it's really difficult for him to be
part of the care team.
hello?
Wow.
Ooh, that's a tough one. You know what? There are many different that work on the front lines, incredibly engaging and accommodating and want to really work and support family members, and some really don't understand the confidentiality that's, part of their college of whatever it is, doctors, college of social works, college of nurses, that sort of thing. So we really have some really good tools around what they can share and what they can't share, what you certainly can share with them. You can always give information, and they need to accept it. They don't even have to say that they're supporting your loved one at that point in time, but you can certainly share things that are going on for you at home. Like I mentioned earlier, you guys are eyes and ears of your folks 24/7. Whether they live with you or not, you're always at the other end of the phone call hearing some of the things that are going on for them. When they present in their appointment for, half an hour appointment, 20 minutes appointment, 15 minutes appointment, whatever appointment time they get, they're fine. Yep, everything's good. Yep, I'm good. And meanwhile, and not intentionally, because at that point in time, they've got themselves well and they've, got themselves to the appointment and things are going okay for them. But they may forget, just like we do when we go to a doctor's appointment. I do when I go to see my GP. I write down some notes about some of the things I've been experiencing, because by the time I get to the doctor that day, I don't have those issues or conditions anymore. And so I've kind of forgot why I've made my appointment, right? So it's just really easy for us to be the eyes and ears for them and share that information. So you certainly can share that information to people in terms of people that are on the care team with your loved one. Another big factor of helping someone is really helping to figure out how to be a support in their life, and also kind of helping maintaining a healthy lifestyle, right? It's difficult sometimes with folks, and then the limit, the money that they're on limits the type of choices they can make for food. And it's when you're not well, it's easier and you feel more comfortable sometimes grabbing a bag of chips, a day one, day two. But when that gets to be a chronic thing, right, then we start getting into poor eating, other unhealthy lifestyle choices, that sort of stuff. So, you don't always just have to be there for them monetarily, right? You can try to be a part of, having an opportunity to get out for a walk at some point. You just kind of have a set date in mind, and we meet such and such place, those kind of things. So, you try one day and it doesn't work. You try the second day, it doesn't work. But maybe the third time you offer it, it might work because they're in a different frame of mind at that point in time. So we always say to people, even if you tried something once, twice, three times, don't give up. Every day they're in a different headspace, and they're maybe doing better symptom-wise than they were the previous time when you offered that sort of thing. So it's sometimes, the same 4 or 5 things offered different ways, offered different times, offered by a different family member, those kind of things. So yeah, it's really important to just maintain a sense of calm and really try to help support your loved one wherever they're at. Sometimes they don't want your help because you're part of the delusion, like I mentioned. We're just going to put on a really quick video for you to see right now.
Janet, can we just get your help to drag that over?
Yeah, you bet. Doing that right
wonderful,
now.
thanks. It's really short and snappy, and I think hopefully we'll bring home a couple of the final points.
Right.
Okay.
And sometimes it feels like it's right up on me.
And sometimes it feels like
And
it's right up on me.
I can just feel it, like
And
literally feel it
I
in
can
my
just
head.
feel it,
And it's
like
relentless.
literally
And
feel it in my head, and it's relentless. And
I don't know if it's going to stop. I mean, that's the thing that scares me the most, is that I don't
know if
know
it's going to stop. I mean,
if
that's
it's
the
ever
thing that
going to
scares me
stop.
most, is that I don't know if it's ever going to stop.
Well, you do have a nail.
You do have
in your head.
a nail
It is not about
in
the
your head.
Are you sure? Because
not
I mean, I'll
about the
bet
nail.
if we got that out
Are
of
you
there.
sure?
Stop trying to
Because,
fix it.
I mean,
No,
I'll
I'm
bet
not
if we got
trying
that
to
out of
fix
there.
it. I'm
Stop
just
trying to fix
pointing
it.
out
No, I'm
that
not
maybe the
trying to
nail is
fix it. I'm
causing.
You
just
always
pointing
do
out
this.
that maybe the
You
nail
always
is
try to
causing
fix
always
things
do
when what I
this.
really need is for you
You
to just
always try to
listen.
fix things
See,
when
I
what I
don't
really need is
think
for
that
you to
is what
just
you need. I
listen.
think what you need is to
See,
get
I
the
don't
nail
See, you're
out.
not
think
even
that's
listening
what you
now.
need.
Okay,
I think what
fine,
you
I
need
will
is to
listen.
get the
Fine.
nail
See, you're
out.
not even listening now.
Okay, fine. I
It's
will
just-
listen. Fine.
Sometimes it's like
Sometimes
there's this
it's
achy,
like there's this
I don't know
achy,
what it is.
I don't know
And I'm
what
not sleeping
it
very
is.
well at all. And all my sweaters
not
are
sleeping
snagged.
very well at
I mean,
all.
all of them.
And all my sweaters are snagged. I mean, all of them.
That sounds really hard.
Sounds
It is.
really hard.
Thank you.
It is. Thank you.
Ow!
Come on, if you would just
Don't.
Ow!
On. If you would just keep on talking till I can go.
Oh, no.
Yeah, so it's very tempting for us to give advice and want to fix things, right? So sometimes our loved ones just want us to hear them out, right? And what we're kind of trying to do at that point in time, and don't realize we're trying to do it, is we just want to validate their feelings, right? Their emotions, what they're showing us, and that we can do by, building trust with them and talking to them about their feelings and their emotions and letting them know it must be really difficult to be like that, or it must be really frightening or very scary for you to be experiencing something like just really kind of getting down to their level and just listening to what they have to offer, as opposed to us getting into fix-it mode, is really kind of what we're trying to articulate there.
So I'm really sorry, you guys. I have just need to reload the webinar. It'll just take 1 second. You can keep talking.
Okay, all right, I can talk. Sam, I just noticed over that you mentioned that it's incredibly difficult as caregivers because you need support too, and absolutely one of the big pieces that we talk about with our folks is about having time for yourself, right? You're no good to anybody else if you don't take care of yourself, so you need to find a way that you need to get out. If it's for going for a walk, getting a set time that you've got to go to your yoga class, but you feel like you can't go to yoga class because, all heck's going to break loose the minute you leave home or something like that. But chances are when you come back, things are going to be still okay. But if you aren't doing things for yourself, you can get yourself into that dark hole for sure, right? You can certainly fall into depression yourself, and you can certainly start seeing things as really bleak and that it's not going to get better. So if you're not practicing good self-care, it's really difficult to have a positive outlook as well, for sure.
And one of the signs I found with my mom in particular is that if that video that we show that cheeky, but is sort of a reminder around just the importance of empathy when your care recipient is in distress. If you find that you're like so burnt out that just finding that place of empathy is so taxing, that's usually a sign that, like, that's a different warning sign around your own emotional reserves. And I could find that after a while. My mom would scratch her head, and my dad's now in a facility with his dementia, but she was just like, but I did everything for him, and I just don't get why he doesn't like me now. He doesn't like to be around me. And I said, it's because the way that you did it, like it was that you were so burnt out, you couldn't, that compassion was gone. Like, she was so fatigued from the doing and the making of the sandwiches and the changing of the bed sheets and all that kind of stuff that she couldn't say, oh my gosh, that's so confusing. Oh, that I can see how distressing that is, or she couldn't actually find that place anymore, and that should have been the first sign that she needed other people. I mean, we tried, but that she couldn't just do it all. And so I think just something to keep in mind when Janet first came to Here to Help, to our group, and showed the slide, which was so on point, and you probably used it in other webinars, Janet, which is, you know, that you have family members like, I'm okay, I'm okay, I'm okay, I'm okay, and then it's like, I'm done. Suddenly, like, you know, you're holding it together, and then there's this big crash. It's not this slow descent. It's just like one day, no, I'm not okay, and that's exactly how I experienced it too. Is caregivers have immense reserves, but then when they're done, and it happens fast. So it's important that you fill up your tank, because your proverbial tank is just super important. It's really easy to skip over though.
Mm-hmm. Yeah, absolutely, and that's what a big piece of the support group does, is it just really helps bring like-minded people together. We share together, we cry together, we laugh together. Sometimes things that are said using, how can someone laugh through this? But when you've been through it and you're doing the same thing, you really can have to just kind of agree to laugh over some of the ridiculous things you've tried because you don't know what else to do, or you're at your wit's end kind of thing, right? And so it's really important that, yeah, you recognize your own signs and symptoms as well, not just for your loved one when things are maybe not looking so good. You know, family members, another big piece of why they're important to be a part of the whole equation is that really they're the ones that you can detect the early warning signs, right? When someone is heading for a relapse, you as a family member, you're the one that's probably going to notice those relapses before they even notice them themselves, because chances are whatever were the symptoms last time for relapse, those symptoms will probably start to present themselves again, right? I know with my cousin, it's his, 3 o'clock in the morning emails to me, and I'm like, you're not sleeping, buddy, right? So you know that things are not going well at that time for him. So you start to pick up on that, and he doesn't have no sense of timing. He's just on his computer day in and day out, so he doesn't really he loses track of all his timing and concept of time, and, what's a good time to sleep, and how much hours of sleep should I need, and, a lot of those kind of things. So we can pick up on stuff like that. We just had a slide up here about possible risk factors for maybe heading into a relapse, or when folks are on changes in their medication. Right? Sometimes they are doing the plan. They're completely taking medications as prescribed. Making sure they need to do what they need to do, and sometimes those medications may stop being effective, or maybe they've come on other medications come on the market that's kind of better off to treat the symptom cluster of symptoms that they have, that sort of thing. I'm not sure in Vancouver Coastal, I'm pretty sure it's the same, but certainly in the Fraser-Health region, we had many turnovers in treatment providers. Some people I know could probably have 10 case managers throughout their time at the mental health centers, right, just with folks coming and going, taking different positions, being off on leave, that sort of thing. So that's a huge stressor for folks. People sometimes don't get it, like that they still go to the same center and they're going into the same environment. But when you build a rapport with someone and you lose that caregiver, that service provider, you kind of feel like you need to start all over again, right? Because they can read the file and they can see what you've been saying, but it's building that relationship, right? And relationships are huge for folks in terms of wanting to be engaged with the system or wanting to be engaged with their service provider. Certainly, different stresses can all add up, right? Can be a major loss for someone that can add it, or it just can be small little stresses that just all kind of compound on top of each other.
So Hardeep, can I ask you a question about that?
Yeah.
If you're a caregiver and you've been caring for someone with a mental illness for a long time, this tends to be the kind of call that we get on our caregiver support line. And that's a perfect example. So you've been through a number of healthcare providers, either through a mental health team with a health authority or through some community organizations, and then there's change in staff and you're kind of out there. And so 2 questions, I guess. How would you get reconnected through the mental health system? So you guys have both offered, people could go to your website or call your organization depending where they live. But how would you recommend that a caregiver introduce themselves and the history that they have to a new professional?
Yeah, so usually, depending on the time, but it's a half-an-hour appointment or something like that, if you already agree, if your loved one already agrees that you're okay to go to the appointment with them, I always encourage them to say, you know what, if it's a half-an-hour appointment, you call ahead as long as you got permission from your family member that could I have 10 minutes of the appointment time. I just want to come and introduce myself, and, because sometimes, this is a case where somebody wants their loved one to be involved, but, there are times when people are not wanting their loved ones to be involved, and we can still manage to get them involved because they can kind of give a little bit more of the history of, right now, because I'm part of the delusions, he or she doesn't want me to be involved, or they think I'm conspiring against them. But I just want to share, in previous times, I'm the one that's been there to do da-da-da-da-da, right? So you really have to be able to, build a case for your involvement. But yeah, we really encourage families to ask if they can be a part of that meeting for not the whole time. If it's a half-hour meeting, ask for 10 minutes of it. Last 10 minutes, first 10 minutes, whatever they agree on. And that's way you're giving the power back to your loved one to say, yeah, I'd like to come and be a part of it, but I know it's your meeting time, and I know you've got things that you want to discuss that are part of your treatment that I don't want anything to do with. But do you mind if I come in for the first 10 minutes? And usually those kind of conversations do go well.
Well, and so if any of you have any comments on that's really good advice, I think. Thanks, Hardeep.
Oh, yeah, you're welcome. And then the other, when we talk, those are the risk factors, and we talk about early symptoms, right, is sometimes you'll notice your loved one, really having issues with their sleep. Either they're sleeping all day long or they're not sleeping at all, right? So those are really super early presentations. That's what I tell them, this is, you're not going to be able to pick up a hallucination is or someone's having a delusional thought, but you can pick up on the early symptoms of, if you're sleeping a lot or not sleeping at all, coming to school completely, unkept, hasn't showered, you really notice the change in their behavior. Same thing with appetite, right? Feeling like they're never full, or really just kind of picking like a bird and saying, I'm kind of full, I'm not really hungry. So those are really good signs for anybody that's maybe even not super closely connected to somebody, but do see them on a regular basis and pick up on a lot of that behavior for individuals.
I'm just going to remind people who are listening by phone to press *6 to mute yourself. We can hear a bit of background noise. Thank you.
Yeah, so we'll just go on to number 14 now. Sarah?
Yeah, I'm on. Hopefully people can hear me. And so that was sort of just a very a broad brush overview of sort of managing in the moment, some sort of difficult emotions, and then, ideally that last step you can do, with your loved one when they're doing better. Again, better is relative, but there usually are periods of relative wellness in between sort of downtimes, and it can be hard to sort of think about relapse when you're not ill, but anyone with, irritable bowel syndrome or asthma or anything, they all know that there's actually a lot of benefit to sort of thinking this might happen again, even if it's a long time in the future, and, what does it look like? And so having that conversation, I know I had that postpartum. I had it with my husband around like, oh, this is what it looks like when I start to, go down, and he could confirm it, and he could add a few things that he noticed that I didn't notice, and so it's a really good conversation. So this section is really around sort of key resources, hopefully can be of use to you. Some of them we've sort of hinted at or mentioned already, and hopefully they're extra sources of support. And I realize that we haven't really had a whole section around sort of in I guess, working with treatment providers and working around privacy and consent and all of the information sharing. I think information sharing could be its own webinar because there's a lot of misinterpretations, as actually providers can share more than they think they can in many cases, and so yeah, I think I'm learning from the chat space that that's something that we could probably do another webinar on in future. So just to start, maybe some of the courses. So these are sort of multi-session kind of courses that you might find of use. Some of these you might have heard about, some of them you might not. The first one, Hardeep has already mentioned, around strengthening families together. And over 10 weeks, and there's a First Nations edition as well. And again, it's not just for schizophrenia, it's really around really any major mental illness. And it's also a place where you're going to get support from other folks who kind of know what it's like, and that's a huge part of just people who understand. And it will go over some of the stuff that we've hinted at around sort of how the mental health system works in BC and who's involved, criminal justice system. Hopefully you'll never need to involve police or in getting help for a loved one, but I think that piece is covered in the course, and just around sort of communication and boundaries, and managing stress and self-care and all of that, and crisis planning. So yeah, it's an excellent course. It's offered throughout the province. So do talk to your local BC Schizophrenia Society. Again, even if your loved one doesn't have schizophrenia.
You could just jump on our website, bcss.org, and see the next upcoming SFT is in your community as well. So we do have them over on the island and certainly on the mainland.
So that's one course.
Online or in person?
I'm sorry, it's in person. Yeah, you would come and attend a 2 hours a night session for 10 weeks.
Oh, okay. And is it free?
Yeah, it's free. It's absolutely amazing. I've been teaching this course for about 9 years now, 9-10 years. It's an amazing course. Families love it. They want to make their own little support group after the SFT because they really bonded.
Right. Thank you.
So excellent question. So it's free and it's face-to-face. So some other places to get support and courses, of course, I didn't mention Family Caregivers because I knew that would be off the top, but that's another resource, of course. Self-Management BC courses, so those are also free, and they are group-based. They're face-to-face. You can also get, there's an online version if you don't have one in your community that's face-to-face. They also have a phone-delivered course. Well, it's not a course, but a phone-delivered option for the material. And their focus, again, is on living with a chronic condition. And because the reason why it fits is because we've talked about at the top that mental illnesses, have a whole lot in common with diabetes or chronic pain or those kinds of conditions that have ebbs and flows, that have lots of treatment providers, medications, multiple modalities, and that have an effect on your mood and anxiety and all those things. So there's so much in common that that people with mental health conditions are certainly welcome, as well as family members. You do not have to be the person living with the condition. Family members are welcome. Even though the course isn't designed for caregivers, I should mention that, but they do say that caregivers are welcome. And so those are free, and they're all across the province. So the website is there if you want to check out the courses. Bounce Back, this is not face-to-face. This is phone-delivered. So this is also free, though, and it's free. You do need a referral from a doctor. Usually it's going to be a GP. And what it is it teaches, you'll work with a sort of community coach from a local Canadian Mental Health Association, and they'll work with you, or potentially your loved one if they're amenable as well. But they're really working around helping anyone over 15, 15 to 99 plus, deal with symptoms or struggles of low mood, of depression, of anxiety, of stress. and use approaches from cognitive behavioral therapy, which is a very effective psychotherapeutic approach to wrestling with depression, anxiety, and stress. And so you'll learn some really good skills around what to do with unhelpful thinking, managing worry, solving problems, getting started again when you feel like you don't want to do anything. So it's really useful for caregivers because you're not immune to depression, anxiety, and stress by any long shot. And if your care recipient is also experiencing depression, anxiety, and stress, it's an excellent, and it's accessible because you don't need to go, get out to an appointment and figure out parking and all of that mobility stuff. You can do it from your home, and you can do it by phone, or you can do it by like web chat if you don't like phone. So bounce back is definitely an option. And I mentioned RAP courses here, which are called Wellness Recovery Action Plan. I don't see as many of them around anymore, but if you do come across them, they are really good courses. And they're more probably for your loved one, I suspect, but would be really useful for you to attend with them. They're for someone who's currently well and wants to really work on relapse prevention. And so occasionally they're offered through mental health teams. So if you do see it, or you can inquire if there's anything similar, they can be really, useful courses. So.
I know, Sarah, that in the Fraser region, they did a ton of them, but they started moving them to the clubhouses. So the psychosocial rehab facilities in the communities where folks with mental illness go to, and then they do the RAP program through there. It's been very effective.
Oh, great. Excellent.
Maybe
And I see in the chat space that people are very on board with an information sharing webinar, so we can chat more about that. I don't think we're going to answer all of those questions today. And then there's two other courses that I thought I'd mention. We offer them here at Canadian Mental Health. They're not free. They have nominal charge, and they're not specific to caregivers, but as I described them, you might find them useful, especially if you've tried everything else and they sort of seem to, hit the, I won't say hit the nail on the head because of the video, if they seem to hit the mark. So one is called Living Life to the Full, and this is like sort of a bit playful, but accessible, I should say. It's an 8-week resilience course, and again, it's based on those sort of principles of cognitive behavioral therapy, and they're really dealing with sort of how to handle depression, anxiety, and stress, and just get more out of life so you don't feel like you're just always treading water. And it focuses on building confidence and managing anger and how to reduce some of those unhealthy behaviors and start up those healthy behaviors you've been avoiding, and problem solving. So it's some really, really good skills, and can really help if you're really struggling with making self-care a priority. There's some really good tools in there to help, help you build that part of your toolbox. And the Understanding Addiction is an online, it's a self-paced course, and it's the good thing about it is it's geared to non-specialist to non-specialists. So it's not for addiction workers or anything like that. It's actually designed for, landlords and bus drivers and people who might come across someone who's struggling with substance use challenges, because that often coexists with mental health problems. But we have heard a lot of family members take the course and found it useful as well for sort of understanding, helping them understand how to think about and support someone who's having substance use or gambling or any sort of problems around the whole addictions area. So anyway, I just mentioned those two courses as two other sort of options for people, but those two aren't free, but they're quite inexpensive, I would say.
Great.
And this one, I think, over to you, Hardeep, for this next one, and then I will close it with the last couple of slides, and then hopefully open it for some questions and discussion.
Yes, so as I mentioned earlier, we do offer family support groups in the community, and we do have an online support group as well. Someone actually was asking that question. They feel better typing the questions and speaking. I'm not sure 100% how often it's manned or covered, but certainly you would someone would get back to you in a timely manner. It may not be instant online chat, as we're just going through some changes right now with the coverage on that. But yeah, we run the groups in the communities. In the 24 educators throughout the province, many of them run their own support groups, or they're in conjunction with maybe another organization there, that sort of thing. We, through BCSS in my Surrey region, ran one for 18 years. We've just closed that one down when I moved over to the Vancouver region. But we are running one in the Vancouver region now. We had one last month. 12 people came. It's kind of just starting up, and it's fantastic. So people are, encouraged to call or check our website, or, call us and find out where and when we meet. Mood disorders certainly offer depression and bipolar group for folks with lived experience, I believe. Is that correct, Sarah? Or is it for family members as well?
It would be for both.
Yeah. Oh, okay. Yeah, and I know at one point in Surrey they had a group that was run for family members, strictly in Punjabi, to work with folks around depression, anxiety as well. And there's a substance use line as well that folks can call. And certainly, if you're at all not able to kind of figure out what even you need, the BC 211 number you could call. They give a lot of information on there as well, kind of like the Red Book online, and you talk to somebody.
Hardeep, we had a question about the online support group. Is it a private Facebook page?
No, it's not Facebook. It's an online support group that you could get the extension from our website. And no, it's not Facebook related. Okay. And it's private.
All right. Okay, great. Thanks.
Thanks. Sorry.
Right now. Sorry. So it's Janet speaking from Family Caregivers. I'll just put a plug in right now that we are not disease specific. So Family Caregivers of BC, we consider ourselves to be generic caregiving. And we get a lot of people who come to our support groups that are supporting people with all kinds of chronic conditions and illnesses. Our support groups are totally open. So if you live in a community that just has a general caregiver support group, that's another consideration for you. It might not be that, the topics being discussed fit exactly with what you're going through, but very often, they can talk about feeling emotionally drained, stressed, worn out, burnt out. It's that community of sharing, just to have someone who understands what you're going through emotionally.
No, thank you, Janet. I completely forgot to sort of add that at the top of the slide, because I knew you would be doing that in your sort of the wrap at the beginning. So no, absolutely. These are sort of additional ones in case you happen to have one in your community. But yeah, absolutely. I think the more options, the better.
Yeah. Take advantage of everything you can. That's what we always say.
So our last couple of slides, I'll mention some of the resources I sort of teased about at the beginning. So here to help, again, I mentioned it's sort of a group. It's a collaborative of these 7 agencies, and we do have a flagship website that's been around since 2004. We get over 2 million people visiting it, so it's quite popular and entirely free. We have a couple different emails. They all go to the same place, but ask us or BC Partners at both of them will come to our team here of information referral. It's not a crisis service. You're not going to get an immediate response other than our automated message saying that we got your message, but you'll get more than a line back, and people are really appreciative. They're sort of tired of getting voicemails, and they're getting tired of having to drill down a phone directory to not get talk to a live person. And so this, you'll actually hear from people who know how to sort of navigate the mental health system in BC. And outside BC, we can probably point you to a mental health nonprofit that can help you. So we get requests from outside BC as well. But on that website, we have hundreds of personal stories, including many by family members around just life and surviving and thriving with mental health or substance use issues. And people find tremendous hope and sort of options and motivation and inspiration. And so, when you're feeling alone, it's a really good place to go and check out the personal stories and feel a little less alone. One of our most popular features on the site are the next two bullets. Is we have sort of these little self-tests that you can do, kind of those quick polls that you do at the front. We have one, on depression. We have one, that's asking you around certain symptoms of depression. We have one around anxiety. We have one around drinking. And we have one around sort of just general mental well-being and resilience. And I think those are good ones just to check in. They're anonymous. We don't track you down and send them off to your doctor or anything like that. But they do give you a really good interpretation page, tell you what your score means. It's instantaneous, and then give you a whole bunch of resources, as well as something you might want to print out and take to your a healthcare professional if you're like, oh wow, maybe it's somebody in the chat space is like, I take it and wow, I'm more depressed than I thought I was, right? I actually need more support before I can be any support to my loved ones. So I'd urge you to check those ones out and retake them. The mental well-being one, anyone can take. I mean, ask questions around whether or not you feel vitality and whether you feel loved and whether you feel you can solve problems and think clearly. And that's a good gut check for most people, whether you're caregiving or not, around how life is going in general. So. And then our free publications, so we have lots of stuff in just straight HTML. You don't have to download anything. We have PDFs. And we have a number of different resources for family members. These are just 4 of them that I think you'd find the most useful. So one is called the Family Toolkit, and BC Schizophrenia Society, CMHA, and a host of us sort of wrote this way back, and BCSS is the primary author on it now, but it has a lot of the skills that are in strengthening families together, not all of it and not the mutual aid part, but around communication and boundary setting and just understanding more about what the heck mental illnesses are, what they look like, what treatments work, and strategies to getting help. And then the Mood Disorders Association in our collaborative, they took the lead on writing the next one, which is called Family Self-Care and Recovery, and that's really focused on you. It's focused on how do I support myself and stay well, because this is really, really hard. And so that one's also very popular, and it's a good companion one. The coping kit is written by sort of someone outside our collaborative, but we like it and we put other stuff on our site, including family caregiver stuff too we have on our site. So the coping kit is for families who have an adult living with a substance use problem, often with a mental illness thrown in as well. And so that, that can add another whole layer to things. And it can be really, really challenging as well. So there is another network of support for you. The writer of that kit is called From Grief to Action, and that's a group of family members around addiction. They have a good website as well. And our Managing Mental Illness series, we have one just generic mental illness, and then we have one managing depression. They're very, very similar, and they're sort of kind of little mini workbooks that have three pieces under each. So the managing series, they have one around dealing with a diagnosis, because that can be really, it can be a relief. It can be, really hard to hear. There can be a lot of loss and grief around it. There can be celebration. I mean, there's a whole host of emotions just getting diagnosed. So there's one around how to cope with diagnosis. There's one around how to work with treatment providers to figure out, a treatment plan that works for everyone. And then there's one around planning for or preventing relapse, and it has a few sort of couple embedded worksheets around how do I come up with a plan using some of the things from the slide that Hardeep was mentioning. So these are just a few of like a whole host of resources on the site that are free, and we hope to keep adding more. But we definitely welcome you to visit, and we're overhauling the site entirely, and it's going to be relaunched in March. Much friendlier for phones and all the sorts of stuff. So please visit it. And then finally, before our last slide, are some key kind of websites or phone numbers to keep handy. I don't know if folks in BC know that there's a really excellent service called the BC Mental Health Support Line. It's a 7-digit number. It's not a 10-digit number. Do not put 604-250-778. No area code, please. So you call 310-6789, and it's a 24/7 number. And it's you can, if English is not your first language, they will link you to an interpreter. It's just a wonderful service. And if it's a set of interlinked distress lines that have received special training around sort of mental health and substance use. And so if the first number that it gets passed to is busy, it will pass to the next one so that you don't get a busy signal or voicemail. So it's got a very, very high call answer rate. So I really recommend that you guys have that number handy. You don't have to be in crisis, or actually even it's anybody who needs to talk, who needs to get through a rough moment. And because I know the family caregiver line, that is fabulous, but I'm pretty sure it's not 24/7. It gives you another option for, that 6 in the morning or midnight. You just really need to talk to someone and figure something out, and they're just fabulous people on the other end. So please keep that number handy. We refer people to it all the time. 811, of course, which is HealthLink BC, formerly the Nurse Line. They have health system navigators, I forget what they're called, health navigators. You can also get access to a nurse, pharmacist, or a dietitian through that number, but the navigators who answer the phone can help connect you to services as well. And their website actually has a really good mental health section that gives you, helps you find your local mental health team, can help you find counseling, can help you find intake, like what the heck is intake, just to find a lot of these words. So really like HealthLink BC. Local mental health organization, we've already mentioned that. Two of the main ones supporting families of adults. Big one would be BC Schizophrenia Society, of course. Some branches of Canadian Mental Health Association in BC do a lot of work in this area as well. So those give you just two options. There's certainly many other organizations that do this. And then Disability Alliance was something that Janet reminded me to add here, which is there are a lot of issues around sort of income, and other sort of supports that, people with mental illnesses very often, when their functioning is so disabled, they actually are considered to have a psychiatric disability, and so they actually are eligible for a lot of the same supports as someone with a physical disability. So they have some really wonderful staff there who can help you navigate, especially a lot of sort of tax credit, income support type questions I find the most. And they have a great series of information sheets and things like that as well. So definitely check them out. You do, I know how draining.
Thank you so much for doing this. It's terrific. And I'm so glad that we have tapped into each other.
Oh, likewise.